respected Chairman and my other panel members. I stand before you as one of the stakeholders in the whole universal health insurance scheme, particularly the government's scheme for the people in various states. People like me have been handling this scheme as service providers for the past almost 10 years, particularly in the state of Tamil Nadu, and I have always appreciated the scheme that is done in other states like Andhra Pradesh, Karnataka and Gujarat. When this scheme started as a government scheme, there were a lot of apprehensions and people thought how it will work. Only private insurances can work very effectively and so many other things. But over a period of time, I think this government scheme very nicely evolved and matured into one of the best model schemes even for the private sector. In my opinion, if there is any initiative, the PPP initiative in the health, the best example could be this scheme. I have no doubts in my mind because a person like me has handled it for 10 long years. I started my career in corporate hospitals. I have always worked in large corporate hospitals like Apollo Hospital, Kovai Hospital and Kaveri Hospital, and fortunately for me, I have also had the experience of living through the entire cities of Tamil Nadu. Call it the metropolitan cities, call it the tier 2 cities, call it the tier 3 cities. I have worked in all the hospitals in Trichy, in Madurai, in Coimbatore and in Chennai. And I have found this scheme working extremely well. Just to tell you how good is this in terms of PPP, doctors here told us that the government of Andhra Pradesh almost paid about 1,100 crores last year, and this year they are talking about 1,350 crores, and Dr. Salanayang was saying that they have paid about 850 crores through this health insurance scheme to the various hospitals. Be it the private hospitals or the government hospitals, they have paid so much of money. I think this is the best route you can ever pay to the private sector. If you give it as a grant to any of the government hospitals, we do not know how it is being spent. Or if you give it again as a loan or in some other form to the private hospital, again it won't work properly. But in this we are paying for the cost of service provided to our public, and they have also had systems to identify the kind of hospitals they will work with. If you have seen both the government of Tamil Nadu and government of Andhra Pradesh, they have very good system of evaluating the hospitals. They have certain criteria for the hospitals to become members of this scheme, and they ensure that only the right hospitals are included in this scheme. And at the same time, they also ensure that the public have a hassle-free process of getting into the hospital and getting this treated, and that too completely cashless. In fact, I should recall what our Joint Secretary Health, the Government of India, told us yesterday. He went on to say that in India, unfortunately, maybe the press or the media or even the civil society sometimes become very cynical about the way the government hospitals work and government schemes work. He said we should not be cynical. Maybe there are certain one or two areas which need to be improved, but there are several instances, there are several schemes which are working very effectively, and one of these such schemes is this the government health insurance scheme, which works beautifully, and this has become a model. I must also compliment that the government of Andhra Pradesh initiated this scheme, but I think each one of them, whether it is Tamil Nadu or Karnataka or maybe Gujarat, are trying to excel each other in this scheme. And to say that 85% of the population is covered under the scheme is a great achievement, and I think even in Tamil Nadu we have covered about 4 crores of people in this scheme, and I don't think any private insurance can ever think of covering this. And if you've also seen the statistics that health is one thing which is in the below poverty line, that is one thing which causes more poverty because of the healthcare costs. And if this scheme can work, I think the poverty can be eliminated, not entirely, but to a large extent I think we can eliminate poverty. The another interesting part of this scheme is the payment which the hospitals receive. Much was talked about the mechanism of making payments, pre-authorization and things like that. As a service provider who has seen the payments coming in, if there was any delay in payment from the government, it is not because of the government. Believe me, in fact, I have said this in many forums. It is not because of the government, it is not because of the process. They have an excellent system in place, they have an excellent processes in place, and unfortunately the provider hospitals don't give the adequate details in time. That is the reason, in fact, we have found, to my knowledge now, today government hospitals, government clears the payment much faster than the private insurance people. That far I can tell you, and substantial amounts keep coming to the private sector. I was also trying to ask these leaders of the scheme, what kind of percentages are we talking about? In fact, in his presentation, he said that we started with about, say, 5 to 6% to the government hospitals. Then now we are in the range of about 25 to the government and 75 to the private hospitals, which is understandable and which is also growing. When we started the scheme, I know that many of the government hospitals in the neighborhood never would do this kind of work. But one very smart thing they did was they gave incentive, which you also mentioned, that they gave incentive to the government hospitals. They didn't give it to the individual doctors. Please understand, in Tamil Nadu at least I know that the incentive is given to the hospitals, and the hospital has also a share to improve the facilities in the hospital, and the doctors and the staff who perform the surgeries also get incentive. In the process, I think they also started doing more and more. And one more thing which they did very intelligently is to remove certain common procedures like appendicitis and all that from the list, and then put it into the government hospital. And they held out certain procedures which are very difficult procedures, highly cost intensive procedures in the private sector, and I think that balanced out very well. And I would like to see 50-50, you know. I would like to see a time when these leaders come and tell us in the next few meetings, saying that, you know, the private hospitals do 50% and the government hospitals do 50% of this. Another very interesting thing that happened because of this scheme is that the hospital tariff got rationalized. Believe me, you did a great job by saying that, you know, we are giving you 560 crores, we are giving you 800 crores, we are giving you 1,100 crores, so better be careful on the tariff. So I think the government came in a very nice way. They came in a very intelligent way to the hospitals and said, if you have to do open heart surgery, do it at 90,000 rupees. If you have to do an angioplasty, do it at about, say, 50,000 rupees or so. So depending upon the cost of stents, depending upon the type of procedure, depending upon the type of hospital, they decided the tariff, which made a lot of difference in the industry. Believe me, if the government had said, no, all hospitals should charge only this, nobody would have accepted this. But today they gave a carrot and a stick policy. They were also giving huge sums of money, and at the same time they were deciding the tariff. So even the private person who goes into the hospital is also comparing what is the tariff in the government tariff and trying to negotiate the prices, and that is a very, very interesting development. The third thing that happened was, because this thousands of crores came into the private sector, some of the small hospitals developed. You must understand, the intention of the government was to develop the entire healthcare system in the country. Whether it was in the private sector or it was in the public sector, it was in the interest of the society to develop all our healthcare institutions and ensure that they work in full productivity. There is no point in having a hospital in Arandangi which has about 100 beds, but it operates at about 20% of the occupancy. It may not be good for the owner, but it is also not good for the society and to the government. So when the money started flowing into a small nursing home which lives up to the standard and gets money out of the scheme, I think they were able to add more operation theatres, they were able to add more equipments, and the society around that got benefited a great deal. So in the process, the government scheme improved the healthcare to the people, they made it affordable to the people, they made it cashless to the people, they improved the infrastructure facilities in the rural areas, the tier 2 areas. I think it was a great work done, and I think the World Bank should take note of this. And I think, and that too in a country like this with about 1.2 billion people, I think the government schemes are doing extremely well. I'm only seeing If only 4 or 5 states like us are doing this work, just imagine all the 26 states and the 6 union territories can take up this in a big form. I think we will be covering, by the statistics given by Andhra Pradesh and Tamil Nadu is correct. We are talking about 75% of the people covered. You have covered 75% of the people. Pardon me? You have covered 84% of the people in this scheme. That means 1.2 billion people. If all the states can take up, that means the government can simply cover by 80% of the people, almost a billion people we can cover by this insurance scheme. Maybe lastly, I want to say that the healthcare as such in India is maturing. You please understand that. In the morning they talked about the maternal deaths, they talked about the maybe the anemia prevailing in the women in India, and they were also talking about the accidents and things like that. Just about 30 years ago, we didn't have such kind of facilities in the country. But today, be it in the government sector or in the private sector, you have the best of the facilities, we have the best of the equipments, we have the best of the doctors. We are talking about medical tourism. So I think we are in the right direction, and people like us, I feel at least people like us who have been in the field for a long time, should talk about it and tell the public that the government is doing a great job in this scheme, and we will continue to support. We will continue, all the service providers will continue to support the scheme, and it is our social responsibility to do so, and we couldn't have done it otherwise if this scheme was not available. Thank you, sir, for this great opportunity to the private hospitals, and thank you very much. Looking forward for more from you in this direction. Thank you.